Welcome everyone to the Aurora Health Alliance quarterly community meeting. I'm Mandy Ashley, our executive director. Couldn't do anything at Aurora Health Alliance without our affiliates. So you'll see those organizations financially support the Aurora Health Alliance on this page. So we have Vincent Robinson, Jessica Smith, and Laura Dawn, who will all be joining us.
Well, thank you for the introduction and good afternoon, everyone. I hope your Wednesday has gone well so far. So as I was introduced, my name is Vincent Robinson, and I am the community liaison over at Show and Tell. We were formerly Thrive Center, so if you've heard of Thrive Center, we have now transitioned into Show and Tell. So you can go to the next slide. So I'll give you all just a moment just to read our mission statement, and then I'll kind of provide some context and nuances afterward. So with this mission statement in mind, a lot of our work is advocacy work at its core. We do a lot of education with both parents and our youth of our special education families. And so within that population, of course, we want to work more intensely with severe communities or more marginalized communities or people of color, et cetera, et cetera. And so with that, that's where our mission statement kind of comes from. So you can go to the next slide. And so just like a background about our organization. So we are a CPRC. And so PTIs are mandated in every state. So they're everywhere essentially. But CPRCs are really intended to target more severe and historically and traditionally not as or underserved populations. And so that's where we kind of fall in. And so you can go to the next slide. And so when we work with our families and our youth with disability and special need, we offer services kind of up and down the spectrum. And so we like to meet our families where they are. And so through that process, we really like to make it a collaborative process and not a process where we're kind of just leaning in and acting like the expert. We really like to get on the same level in that way. And so with our families, what they can expect is, you can go to the next slide. When they call us, we'll do an intake, and that's like as long as we're open, we're always doing intake, so families can always call. And we actually have been fortunate enough to now get a Spanish line. So we're kind of addressing that one of those access barriers we know with healthcare often is sometimes language. And so we've been fortunate enough to do that. And so families or youth can call, and we really just kind of do an intake with them, take our time. Usually most of our intakes take about an hour because we really like to get extensive and detailed and try to hear our families out. And so along with our services, that's what kind of the parent advising falls under. And then with my job in particular, when we're doing outreach, of course, we outreach to everyone, but we like to outreach to other organizations that are doing similar work. So for example, we like to work with El Grupo Vida, who also does similar work in a similar space in terms of targeting like the Latino community in that regard. And so you can go to the next slide. And so also with our services, a big proponent of what we do is we do a lot of parent education and trainings. Unfortunately, due to COVID, a lot of it over the past year and a half has had to be over Zoom. But typically these sessions kind of look like about an hour and a half on a weeknight. And we like to do, typically we've been doing Zoom, but we've been fortunate to do it in person now, but we'll just do like an hour of educational training around several different topics. We like to have people register and then give them a month to kind of send in suggestions if they have ideas about what they have questions about. Of course, we come with our own ideas as well, but like I said, we like for it to be a collaborative process. So these are some of the kind of workshops we have going on. And the Project Independence is actually our ongoing workshop right now. It started 2 weeks ago, and we're in the third week now. And so this workshop in particular is really around post-transition, post-high school advocacy. And so we have two separate classes. We have our classes with our youth, and that's where we kind of promote the things after high school. So whatever they're interested in, so whether that be continued education, we give them resources for that. If that be go straight into work, we have resources for that as well. We also like to do like a lot of social skills and advocacy training in that way on just kind of independence, hence the title. And then with our parents, when we do this project, we really like to do supporting. How can we support our child? How can we support our youth as they go through this transition and try to become their own individual adult? And you know, they have their own wants and desires. So how can we support that? So that's what this current training is about. In the past, we've had our summer camps, and so that looks like about a week or two. Oh, you're fine. Looks like about a week or two, where we have the kids for like we usually kind of do a lot of different activities. Again, we take their vote, but a lot of the times we go downtown or go to museums, or we'll go to like different colleges and do college tours, or we'll go to different employment places that have specifically employ those with special or that are on the spectrum, or for example, and give them those opportunities. And then through our new e-newsletter, I'm sure everyone here knows, e-newsletter gets blasted super often, because that's where we have a lot of our resources in the community. So when we do get a call, and in an unfortunate case we're not able to help directly, we don't like to just hang up the phone, of course. We like to continue the conversation and point them in the right direction, check on them, and to make sure they get the resources they need. We can go to the next slide. And so again, these are just kind of some of the topics we covered during our training. And also we do take like requests as well. So if there's, for instance, a group that wants more education around this for their team members, we do this training with them as well as with our parents. We can go to the next slide. Yep, and this is just kind of a list of kind of our partner agencies. I already mentioned El Grupo Vida as one we work really closely with, of course, Rocky Mountain Human Services. You can go to the next slide. Yeah, and so this is just our website, and that was kind of like the brief explanation and show and tell, but I would love to talk more. If you have questions, please put them in chat or message me directly, or there's my email at the bottom. Feel free to reach out. Looking forward to hearing from people and connecting, and thank you again for the time.
Thanks, Vincent. I have a question right away, and then I think Joe and I are gonna tag team questions for you.
Oh, okay.
Do you work with like public school transitions programs, like Aurora Public Schools transition program? Like person is normally graduating when they're 18, but the transition program is between like 18 and 21 to teach them life skills. Is there overlap with that program?
So not necessarily. So a lot of
Okay.
our work is around like transition age, in terms of like 13 or 14, like the Colorado definition. So that's like where a lot of our work is done. But
Okay.
we have started implementing like more of the program training, like the one I just kind of mentioned, to gear toward some of that after high school stuff, because we do think, of course, the support needs to be consistent and sustainable, not just that one kind of phase. If that helps answer.
Cool. Yeah, thanks.
Thank you, Vincent. This is Joe with Aurora Health Alliance. I did have a question come to me about if there's any limitations around who you serve in the metro area. Is it just anyone who's in metro area or in the state, or how does that work?
Yes, so I will preface my answer by saying I've only been in Colorado for a year, so my naming the counties is not as great as I would love it to be. But we do it by county basis, and I believe we're at 13 counties. And so, for instance, we're out of Aurora. I know we do like Jefferson, Douglas, for example. That's on our website as well. But if you want like a list, I can definitely shoot that out to you.
So thank you for that. There is another question in the chat. The referral process, service area, which we just talked about, and then qualification criteria. So what the referral process is and the qualification criteria would be great.
Yep. Okay, perfect. So the referral process, do you mean like for instance, if you know someone, or if you have a child that has a need, is that am I understanding that correctly?
Hi, Vincent. Yes, this is Sandra Coronado. Yes, that's my question. Like, I work with pediatricians, and I usually connect them with services. So what would be the process to refer to show and tell?
Absolutely. So yeah, we do work with like medical providers, and it is just as simple as we'd like to give them our brochures or our materials, and they're absolutely more than welcome to give them to patients, clients, and have the patient client call us, reach out to us, and we start the intake process that way as well. So referrals can be done any way, email, you can call us, any way. Really trying to let our services be known, because in this field, as you all know, it's not necessarily easy to get people these kind of services. So
Okay, thank you. And
sorry, go ahead.
No, I was just gonna say, and the qualification criteria, like what families would qualify? What do they need? What's the criteria to qualify for your services?
So we are a nonprofit, and so all our services are free, and so everyone and anyone is qualified. Like I said again, even if they, we're a resource center again, so even if we cannot help them directly, we have, oh my goodness, tons of resources in the community, like in Colorado, outside of Colorado, to help find the fit for them. So there's no like application process, no true qualification criteria. It is on a need basis. So I would encourage anyone to reach out.
Thank you.
Thank you. Good question.
Thank you so much.
Thank you.
Laura Don is our next presenter on the end of continuous Medicaid coverage. So thank you. And Laura, if you need any tag teaming, I am here to help support you. So
thanks so much, Mandy. I'm Laura Don. I work for Arapahoe County Public Health. I'm on the Aurora Health Alliance board, and I'm sharing this this information on behalf of work that Mandy and I are involved in through the Metro Area Health Alliances. So just to give a little bit of context, really want to highlight the importance of your involvement in helping with the end of continuous coverage work. So there will be some asks coming your way, but before that, I'm going to start with what is the end of continuous coverage. So as many of you probably already know, Medicaid continuous coverage is about to end. Individuals who are currently covered in Medicaid are at risk of losing coverage. That first month of renewals is May 23rd. So those folks who have May renewals have received lots of emails, snail mail, reminding them to renew their Medicaid coverage. And the messaging really is around, you need to take action to maintain coverage. That's different than it has been since the public health emergency, or during the public health emergency. Folks were still supposed to renew, but nothing would happen if they didn't. Now there's going to be a more formal process where folks will lose their coverage if they don't renew. Next slide, please. So what is the scope of this issue? Like, why are we concerned about this? It's from multiple places, right? I know primary care offices are concerned, the state's concerned, we're concerned in public health, the health alliances are concerned. So why? So Mandy, next slide, please. This sort of outlines the data, the best data that we have. This is from the state, so HCPF. We know that 1 in 4 Coloradans currently are covered by Medicaid. That's 1.7 million total folks. And you'll see in the blue is the number of the portion of the population that's enrolled that is continuous coverage. So that's the portion that is at risk of losing coverage. Next slide, please. So what does that look like for Adams and Arapahoe counties? So the number of people within Arapahoe County who will need to take action on renewal or renew their paperwork, complete their paperwork, is 176,470 residents. And then what the other piece of this is that there will be folks who no longer qualify for Medicaid. And so that's why we'll talk a little bit about Connect for Health, but 77,650 folks will be no longer qualified and can look towards Connect for Health or our marketplace insurance Again, these are rough estimates, but as close as what we have. Next slide, please. This is just what happens when the continuous coverage ends. So renewal processes will begin March 23rd with renewal dates in May. Colorado is doing this in a rolling way, and so we'll take 12 months to renew all 1.7 million members. So it depends on their individual's renewal dates. So it's really important that individuals pay attention to their renewal notices and fill out necessary forms to ensure that they keep their coverage if they're still eligible, or that they get elsewhere for coverage. Next slide. So just to give you a sense of the somewhat cumbersomeness of filling out a renewal packet. The renewal packets are 24 pages long. Relatively high literacy level is required to understand the packet. They're only, as far as we know, in English and Spanish. HCPF uses terms that can be confusing to the general public, like notice of action or modified gross income. And anecdotally, we know that the PEAK system, which is the system that individuals go on to, or the platform that individuals can go on to complete their Medicaid applications and for renewals, can be pretty confusing to members for navigation. So next slide, please. So what's happening that are underway to sort of mitigate these concerns and to help folks get where they need to go? Next slide, please. That was a nice Colorado picture. Not me rolling the thing up, but someone else. So HCPF, Department of Healthcare Policy and Finance, has had several toolkits, or 2 toolkits out that really go into detail on messaging, social media posts that you can be putting on your agency's social media sites to help direct folks where to go, or what to do and where to go. So those links are included in these slides. Next slide, please. MAHA, Metro Area Health Alliance, has received some significant funding from our raise. So Colorado Access, huge shout out to Colorado Access for helping fund this work. So to be able to give community-based organizations funding to do the messaging around the end of the continuous coverage and getting folks where they need to go, whether it's getting them to help or completing the renewal packet or to connect for health, really just helping with get that messaging out to what we think are some of the harder to reach populations and in a culturally sensitive way. And so that work is well underway. We have community of practice meetings. We're learning from each other. This was a model that was rolled out during COVID for other messaging. But we wanted to utilize the same model to get information out to folks about the urgency of not losing or maintaining their coverage. Next slide, please. And Colorado Access also has some great messaging out there. They have a poster and a postcard that individual organizations or individuals can order. I've included a link to the form that they ask for you to complete, and then they will send you the materials. So if you are an agency that has a lobby, that has a place where people go or sit and could help put information in your organization about this, that's a call to action. Please, please, please fill this form. You're also welcome to reach out to me if you have any difficulty, and I will help you navigate. Next slide, please. So what can you do to help? We kind of covered this. We want to make sure that members keep their coverage and that we ensure that those who no longer qualify know where they can go. So next slide, please. So how are we going to do this? I ask that you, if you have time, familiarize yourself a little bit with the renewal process. We did some of that today, but if you want to dive deeper, those toolkits are there to help. If you're working with individuals, if you can try to find out when their renewal date is, and so that they know when they need to complete their paperwork, that would be great. We in Arapahoe County are working really hard to create a list of vetted assistance sites. And that list will be coming out. I'm going to say it aloud so it's so it happens. But it's going to come out next week. It's currently in our communication with our communications team, and they're adding some final touches to it. But I want to make sure that that is available to our community and to you all. So I will be sending it out via AHA, if that's okay. And then the last ask is what we already talked about, which was ordering materials from Colorado Access by using the form. Again, very important. Any questions you have, feel free to reach out. Next slide. Thank you. And I don't know if there's time for questions, but.
Thanks, Laura. There is a question in the chat. It says ordered materials 3 weeks ago. Do you know the approximate wait time for mailing materials to the person requesting them?
That is a great question, and I don't want to speak on behalf of Colorado Access. I did hear, though, that it could take up to 2 weeks. So if you've been sitting for 3 weeks, Julie, I would suggest reaching out to your contacts. And if you don't have any, happy to circle back with you at Colorado Access and see, see where they are.
And there is a hand raised. Sandra, go ahead.
Hi, how are you? Laura, thank you. I have a question. I don't know if you have the answer to this, but because it's related to SNAP. When I have families, I'm helping families through the pediatricians, and I do the SNAP application. They have been receiving the packages. And when they call me sometimes to do their recertifications, they have been telling me, I find that it's already done. So are they doing, when they send the packet for Medicaid, are they doing the process for the SNAP too? Because that's what we're all confused. It seems like they send the packet and they do both.
That is a good question, and I don't know. I'm wondering if that's a human services question. Is there anyone on from human services? Oh, Rebecca, thank you.
The power of a health alliance, bringing folks together to solve questions at the same time. Thanks, Rebecca.
Thanks, Rebecca.
Hi, Sandra. My name's Rebecca,
Hi,
and I work with the health enrollment site at Adams County Health Department. So my understanding from human services is that there is sort of one back-end system that shares information between SNAP and Medicaid. They implemented that in the last 1 to 3 years to make the renewal and recertification process easier. So if somebody updates their information either with SNAP or with Medicaid, that then will feed into their next recertification. For Medicaid, they still need to sign the renewal packet. So let's say they had changed their address with SNAP and not with Medicaid. The Medicaid packet comes and it has their new address that they said to SNAP. They need to sign it no matter what. So if someone gets a packet in the mail, they do need to sign it no matter what. Not everyone will get a renewal packet because sometimes they're able to do the verifications on the back end if, for example, somebody has already done an address change. Does that help answer your question?
Yes, it does.
Okay.
Yes, it does. Thank you so much, Rebecca.
Yeah, great question. It's a new system, and I think we're all still trying to understand how it works and what it looks like for clients in reality. So, yeah.
Thank you.
Thank you, Laura. Really appreciate the info.
Thank you.
Thank you.
So next up, we have Jessica Smith with Connect for Health Colorado. And we've got your slides all queued up. Jessica, if you want to go ahead and take it away. Thank you so much.
Yeah, thanks for having me. I'm here to talk to you guys about some data from OmniSalud. For those of you who are not familiar, OmniSalud is health insurance for Coloradans who are undocumented. This is the first coverage year that we've ever done this. And we had 10,000 spots to fill, which we weren't sure we were going to be able to do, but we did fill them before open enrollment even ended. We got to the 10,000, I think, by December 1st, and had to turn folks away, which was unfortunate. But I'm here to talk about those enrollments, those 10,000 folks, where they are, and some demographic information. So there's our total enrollment number there as of January 31st, 2023. You can go to the next slide, please. So Silver Enhanced Savings was the $0 plan. So this was for folks who made 138% of the federal poverty level, I think is what it is. It's exactly the same as Medicaid. So these folks were able to get $0 plans. And they had a lot of $0 services. So that is where the majority of the folks who enrolled in Colorado Connect landed. We did have plans for people who were over that income threshold. But it appears that they were we knew they were unaffordable to a lot of people, but you can see here that not too many people were enrolling in those plans outside of the folks who were eligible for the $0 plans. So here is the average age groups of everyone who enrolled. You can see the largest was this 35 to 44, but really like 35 to 54, which is similar on Connect for Health Colorado. Gender was split fairly evenly. Language, you can see the majority of our folks who enrolled speak Spanish, sorry. And then here you have by county how many folks enrolled. So we had a total of 8,000 average in urban areas. Sometimes I think of like Pueblo and Mesa don't feel urban to me, but they do count as urban. And then rural was about 2,500. But Arapahoe, you can see Arapahoe up there, had a basically even with Denver, with only Adams County ahead of those enrollments. And then this is how folks enrolled. So you may remember when I came to these meetings a few times to talk about OmniSalud and how folks can enroll in the coverage. And we really were pushing folks to visit their assistance site. An example of an assistance site in your counties is Rebecca over at Adams County. So she just was speaking, but they enroll folks in Connect for Health Colorado, Medicaid, and OmniSalud. We also have brokers who brokers tend to focus a little bit more on like self-employed and small businesses, and we really try to send folks who are more vulnerable populations to assistance sites because a lot of them are embedded in community-based organizations or human services departments and are experienced with being more hands-on and holding hands for people. So 50% of the folks enrolled through an assistance site, 27% through a broker, and 23% self-served, so did the application on their own. And then these were our top enrolling assistance sites. So I did tell you, we have our assistance sites. A lot of them are embedded in county human services departments or community health centers or community-based organizations. And these were the top sites who saw the most traffic and got the most folks enrolled all over the state. I did see a question in the chat, and I unfortunately don't have the language data of any other languages, so I apologize. This is what I was given from my data team, but I assume that there were people who maybe speak other languages. I know we had a guy from Ireland. I do remember that. Which is English, but we definitely had folks in some of the African communities enroll. So I don't know about language, but I know that with the name OmniSalud, we really were marketing towards Spanish speakers, and we got feedback that it kind of was confusing for like our other like African or Middle Eastern. They didn't know if they were eligible or if it was for them. So we're bringing that to the board who makes these decisions to let them know that was a point of confusion for folks. And we also have asked the DOI for that to be part of the targeted outreach for next year, to focus on those communities, because maybe they can't change the name at this point, but we want them out there doing outreach and directly with this community and making it clear to them that they are also eligible.
Thanks for that. You actually hit on like the crux of my question about the other languages, because I was actually super curious if people who were not Latino or Hispanic were even knowing that they could enroll in this program because of the name. So yeah, I appreciate that.
Yeah, and I will say Connect for Health Colorado, we have a contractor consultant who we do outreach with in African and Black communities in Denver, and she definitely was out there spreading the word as much as possible, but we're going to ask the DOI to also jump in on that, because they have an outreach person specifically for OmniSalud, and we think that was a gap last year. So for next year, we've actually already got the commitment that they are going to do more targeted outreach in those communities. I see a hand, Sandra.
Yes, hi, Jessica, thank you. Jessica, for this year, are you increasing the number of 10,000 or what's
We
happening?
don't know yet. We're waiting to hear from the DOI, and you guys are on my list of folks who will be informed immediately. So Joe will get my email, but we're waiting to hear from the DOI. And they kind of gave us summer as a deadline, so we'll have to see.
Thank you.
Yeah, I hope so. I see Rebecca.
Yes, I just wanted to add one thing to what you said about working with DOI and doing more outreaches. You had shared with the program managers of the Connect for Health sites last week that you're also, I think, focusing a lot on how Connect can provide more education for people about using their coverage once they get it. So how do they get an insurance card? How do they find a doctor? How do they pay bills? So I think that that's really great. So I wanted to share that you're also thinking about that. It's not just the outreach and getting in people enrolled, but once they have the coverage, then what? I also wanted to add, I put this in the chat, but in case people can't see, you gave us a little shout out to the Adams County Health Department Health Enrollment Team. And I wanted to make sure people knew we don't just serve Adams County as a Connect for Health Colorado assistance site and a certified application assistance site with HCPF. We're required to serve people from any county. So we welcome people from across Aurora, whether they live in Denver or Arapahoe County or Adams County. And so we have physical locations throughout Adams County, as well as the Aurora Mental Health Center location on 6th and Chambers, which is technically Arapahoe County. And so I put our phone number in the chat, 303-363-3013, or you can send us an email at healthenrollment@adcogov.org, and we'll be on Laura's list that she's sending out next week. And we help with Medicaid, CHP, Connect for Health Colorado, Colorado Connect. So I'm happy. We've been helping a lot of folks with renewals and happy to continue doing that. And if there's any other sites on the call that also do that, would love to hear from you as well. I know there's a lot of resources to help with both Medicaid and Marketplace in this area. So not just us.
Thanks, Rebecca. Yeah, going into kind of areas for improvement, I think Connect for Health Colorado was really tasked with getting folks in the door and getting them enrolled. And, you know, we need to improve next year on health insurance literacy, because a lot of these folks never have had, you know, private health insurance like this before and don't know those things that Rebecca was talking about, like all the way from, you know, just from the beginning, we saw that it was like getting the cards in the mail was confusing, like things like that. So that's another area we've asked DOI to focus on this year, is health insurance literacy. And then I see a question from Rich.
Yeah, hi, Jessica. Yeah, thanks, Rebecca, for letting us know what Adams County Health Department is doing. I assume that applies also with their Arapahoe County Health Department. They'll serve anyone when it comes to helping people in enrollment. Mandy or Joe, if you're controlling the slide, could you go back to the one before last? I think it listed like Vuela and Servicios as the top two. And my question for Jessica are those organizations in order of who did the most, or
I
just
don't
kind
know,
of
they're not. No, they're just copy and pasted.
Okay. And relating to Sandra's question, that's one that everyone wants to know. And when people are asking us, who to go to, certainly the health departments, but if there are nonprofits nearby like those, we certainly want them to go in and actually sit down with them and get help, because this is not an easy process.
No, it's not. And I will put a link in the chat right now. We have over like 60 assistance sites across the state. So we have a page on our website that says we can help, and you can put in your zip code and find anyone near you who does this work. So I'll put that link in the chat.
Thanks, Jessica.
You bet. Thanks for the question. Oh geez, where am I? Okay.
And Rich, I don't know if you saw Rebecca's message. Arapahoe County provides assistance through human services, but not directly at the health department right now. And then there is a link in there. And again, we will share out slides and any other resources that are shared in the chat. We're happy to share those out after the meeting as well. Thanks, Jessica, for putting that link in. Other questions?
I also will periodically be joining you whenever I have news. I will reach out to you, Joe, and say, okay, I finally found the cap, and come
Awesome.
present to you guys when I get more information. And I'll send any emails to you as well, Joe, that you can share with the group.
Perfect. Thank you so much. Go ahead, Sandra.
Me again, I'm sorry.
Don't be sorry.
Jessica, I have a question. I think I was mistaken about OmniSalud too, thinking that beyond the 10,000 openings, that OmniSalud was continue to offer services, but just for additional payment, but still servicing the same population. Is that correct or not?
So folks who qualified once we already had the 10,000 spots full, they did have the opportunity to pay for a plan, but looking at the numbers, it appears that amount is just too expensive.
Because it was-
there is the option, yes.
But it's not through OmniSalud. It would be to any
No,
other plans in the marketplace.
Yeah, that's where it gets a little muddy and annoying to try to communicate, so I'm really sorry.
No.
But basically what happened was when Connect for Health Colorado put this option forward, we wanted to keep information private because of the threats of ICE. We didn't want to use our regular application because that goes to the federal government. So they have access to all that information. So we created a whole nother platform / application for these folks to enroll that the federal government has no access to.
Okay.
And that is called Colorado Connect. And there are plans available on Colorado Connect, private plans. And there's the $0 silver enhanced savings plans. That's for these folks, these OmniSalud folks. And then the other plans are still private health insurance plans. There's similar plans, but they just don't have the silver enhanced savings.
Okay.
So they cost money.
Oh.
They're the same plans without the savings.
But they're
And they're the same
apply to them.
platform. Yep.
That's it, through
Yep.
that safe platform.
Yes, yes.
Okay.
Yeah,
Thank
so they're
you.
not coming over to Connect for Health Colorado. They're still on that safe, protected Colorado Connect platform.
Thank you so much. That's
Yeah.
helpful. Thank you.
As we thank Vincent and Jessica and Laura, thank you so much for presenting all this great information. We're happy to share out your slides. And yes, thank you, thank you.
Have a good afternoon. Thank you so much for joining our first quarterly community meeting of 2023 because weather got us in January. So our next one will be in July. Thanks, guys.
Thank you.
Thank you. Thanks to our speakers as well.
Mhm.